In the winter time, we always see lots of colds, but we haven't seen that much flu yet, so I think it's coming. The difference between colds and flu is they're both caused by viruses, but cold is a much more mild illness. It causes sore throat, nasal congestion, some cough. In young children, it can cause a low-grade fever, and it lasts about 7 to 10 days, and most people aren't terribly ill with it, although it can be uncomfortable. The flu, on the other hand, is a potentially much more severe illness. In addition to the cough, the cold, the sore throat, you can get nausea and vomiting. Initially, you can get high fever, shaking chills, body aches, and you tend to be very fatigued, and you're sick in bed for about 3 to 5 days, and it can last up to 2 weeks. A lot of people ask me, when is it time to see a doctor rather than just wait out the symptoms at home? And I usually tell them a cold will last a week to 10 days, and you certainly can wait it out. If it's lasting much longer than that, it's probably a good idea to see your physician, because it could be turning into a sinus infection or an ear infection, and you might not know it in a young child. Anytime a child's having shortness of breath or wheezing or complaining of chest pain, or if 4 or 5 days into a cold, the child develops a fever or ear pain, they should be seen to rule out a secondary bacterial infection. As far as the flu goes, some high-risk people need to be seen in the first day or two of symptoms, and those are children under age 5 and anyone with a chronic medical condition, including asthma. Rest and lots of fluids are always important. Older children can be given decongestants and cough suppressants. Any child could be given acetaminophen or ibuprofen to make them more comfortable and to reduce the fever. If they're over age 1, you can give them honey as a cough suppressant. And children under age 1, you could give saline nose drops, use a vaporizer, elevate the head of the bed. If a child has the flu, never give a child aspirin, and it's a good idea to just keep aspirin away from children because of an association with a potentially deadly condition called Rye's syndrome. To prevent colds and flu, get a flu vaccine every single year if the child is over 6 months of age. And everyone in the household, if you have a child under 6 months of age, get your flu vaccine. It's also important to use other measures. You want to wash your hands frequently, use hand sanitizer. Tell your children not to touch if possible, not to touch their eyes, their nose, their mouth. Teach your children to cover your cough, drink lots of fluids, eat healthy foods, lots of fruits and vegetables, get plenty of sleep at night, and exercise moderately helps prevent all illnesses.